I'm Dr. Ellertson. I'm a pediatrician up here at Tanner Clinic and excited to be up here in Davis County. We're going to be answering some questions that we got on Facebook, so I'm excited to try that. So Suzanne asked about when should potty training start and what age or signs. So, you know, culturally there are a lot of different ways that people approach potty training. Most common here along the Wasatch Front. It's rare that we are successful before 2. It can happen. If you're successful, awesome, good for you. But often it's after 2 years of age they're a little bit less stubborn, and so some signs that you can look for that can be helpful is if they're waking up dry, or if they are going kind of hiding or going somewhere private to poop. Those can often be signs that behaviorally that they are ready, developmentally they're ready to try that. Donna asked about the best way to treat eczema. Of course, eczema, there's a wide variety of the way it shows up. There's also some that are very serious eczema, some that have really mild symptoms. The dermatologists that I've worked with in the past say that the fundamentals are going to be moisturizing, find an effective moisturizer, often one that doesn't have a lot of aromas, fragrances, or colors or things like that. And you want to do that at least 3 times a day. Ointments are better than lotions, things like Vaseline or Aquaphor. And if that's not sufficient, then you can talk to your doctor about starting a steroid for a short amount of time. Lisa wanted to ask about how can you tell when it's just a simple cold versus something that is more severe like RSV or flu. And that is a great question, Lisa. Of course, if you ever have any question or concern, feel free to call your doctor's office. Generally, the things that I really want to hear about as a pediatrician, I want to hear if your child is having trouble breathing, or if their symptoms are causing problems with hydration, if they're having trouble, you know, drinking or not peeing very well, those kind of things. And then, of course, high fever that's lasting a while, definitely want to hear about that. But like I said, when in doubt, please give us a call. There were a couple questions about sleep. Sleep can definitely be a headache for parents. I know that I've experienced some of the stresses of sleep, especially with the new babies. Nate asked about his 5-month-old and asked about maybe even using solids to help the 5-month-old get a little bit longer sleep. So that mom and dad aren't waking up every 2 hours. And after 4 months of age, it's quite reasonable to start a solid or 2. Most nutritionists say that by 6 months you can really liberalize the diet and try a lot of different things, with one exception of course being honey. You always do want to avoid honey. But I think that trying some solids, things like rice cereal or some veggies, is a great idea. And also 5 months old is a very appropriate time if the sleep is really stressing you out and making your life very difficult for you to start letting your baby cry it out. And eventually they will learn that, oh, while it's still dark outside, I can self-soothe and get back to sleep. And it doesn't mean you're a bad parent for letting them cry, although I know that that can cause some heartache. Laurie had a question about probiotics. Probiotics are definitely in a lot of healthcare news and information right now. The best information we have right now about probiotics from the American Association of Pediatrics is that they can have some benefit for when your child has diarrhea. It can sometimes reduce the amount of time that diarrhea is happening. It can also be helpful for kids who are started on antibiotics, that it can help prevent some of the diarrhea symptoms. In terms of daily or chronic use of probiotics, so far the information isn't showing that it's that helpful. It doesn't necessarily mean that there isn't benefit, it's just so far the information we have isn't showing that. But the information does seem to show that it's not causing any harm, so I don't think you do any harm by trying it. Kimberly had a question about warts. Freezing often is very helpful, sometimes it's not so helpful. You can try the salicylic acid that's available in the pharmacy. That does take a long time for effect. It slowly wears that away. Other options there are different injections and different things that can be used. Often we refer to dermatology for those things. So you can talk to your pediatrician about that if you want to do something like that. There are a lot of other great questions. Some of them for more serious issues like celiac disease, asthma, and some of them also just took an explanation that's maybe a little too long for a Facebook video. But please feel free to give my office a call if you want to talk about it further or talk to your pediatrician about any of these things. There are some great questions.